discussion with a bunch of constituents about
Forgot your older one back yet?
looking at a governmental issue, and I said,
Yeah, probably.
the thing that you have to remember
Probably.
is, we live in a capitalistic society. Which means we make money off of each other. That's, and that's all right. You know, you can't, what we don't wanna do is start saying, we're gonna control how much money as a,
It's like
as
we
a
can't connect to
government
one of
or
our
society.
services right
We're
now.
gonna try and control
I
how
can.
much money somebody.
Smash this thing.
I can,
Gentlemen, I'm gonna unmute the mic and go live here.
We need to go.
yeah,
Yep,
she's
9 o'clock.
Mail
We'll call this meeting to order. Could we stand for the Pledge of Allegiance? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everybody. Thank
Morning,
you for
Mr. Chair.
coming.
Morning, Mr. Chair.
Okay, can I get approval of the county board minutes? We got a motion by Commissioner Wincher, seconded by Commissioner Lemire. Any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries. Are there any additions or deletions to the agenda? As none, can I get a motion for that?
So moved, Mr. Chair.
Got a motion by Commissioner Jelinski, seconded by Commissioner Lemire. Any further discussion? If none, all in favor signify by saying aye. Opposed, motion carries. Sheriff's Office Public Hearing. Welcome, Sheriff. And crew?
Hello.
Hi, Amy.
Morning, Miss Amy. Morning, Doug. Morning, Sheriff.
and everybody.
How would you like, do you want me to send you the presentation? So you can show it via Teams, or how would you like?
Do you want control or do you want us?
Well, I don't know how you want to present it to Teams. I just thought of that.
Yeah, you can send it.
Send it to you, or I can join Teams quick and,
That'll
that work?
too. Yeah.
He'll talk while I'm doing that.
Sure. So, good morning, Mr. Chair, members of the board.
Good morning.
Sheriff.
Hope everybody's doing fine. So we have Tarani Conlon. She's a sales rep through Axon. She's going to be listening today through Teams.
Okay.
And if questions arise, maybe at the end, if we can't answer it, she'll be available to answer questions as well. As she's setting up, just to give a little history,
Just a minute, Sean.
Yep.
Do I need to open up public hearing or not yet, not until you ask for it?
correct.
Okay, sounds good, thank you.
So a little history, October 26, 2021, we came in front of the board for a planning session talking about Axon and what our intent was and our plans to move forward. At that meeting, we talked about having this open meeting for public hearing and discussion. So that's where we're at. We implemented a survey online following the planning meeting, which opened up November 1st, and it's still live today. So we'll just kind of go over a little bit of that survey so the board has an understanding of what the public's been commenting on. And once Amy gets that up, we'll be ready to rock and roll. So just so you're aware, Doug Rexted, our sergeant investigator, he's been taking the lead on Axon. And of course, Amy Mittendorf, our IT director, she's been doing a lot, if not all, of the legwork. So we're very thankful for both of these parties to be with us today.
We can't see it, so,
Oh,
It's being projected.
but we can't see it down here.
and while we're still working on that, we did a survey through Morrison County Sheriff's Office Facebook page, the Morrison County Government Center Facebook page, Morrison County website. We've also directed on the website, if there's anybody that wanted to email their comments, they could email it to Mary Swenson, who's our office support administrator, supervisor. And they could also contact us by phone. Basically, all the comments either came in on our Facebook page, Morrison County Sheriff's Office Facebook page, and then we did receive some comments on the survey online through our Morrison County website. So that's where we got the bulk of it. And we had a total of 36 comments total that came in from the public.
It presents funny on Teams for you, so.
So I might
hold on.
want to look at your computer.
There we go, that's better.
All right, I'll do my best to try and see what I'm. So the board has this in front of them, correct, the presentation?
Where do you
Okay.
need this?
So I'll just kind of read these bullets. The community input process. So in accordance with state statute, the Morrison County Sheriff's Office created a survey, kind of like we talked about, of the body worn camera. And I already talked about where it was posted and that the survey is still live today. We provided a link, and we're going to go through some of the different questions we asked, and you'll see that there was a total of 105 responses from the community. Excuse me. Could go to the next one. So with that, here were the questions that were provided to the community members. Number one, do you support a body-worn camera program to the Morrison County Sheriff's Office? Excuse me. You'll see 99 responses were in favor with yes. There was 3 no and 3 people who were undecided. And I'll just keep going through these if you guys don't mind, just because there's only a handful of them. I think there's 10 questions. Number 2, would the body-worn camera increase community trust in public? You'll notice we had 83 responses were yes, 10 no, 12 undecided. Number 3, do you feel that a deputy would improve their behavior with the presence of the camera? 62 responses yes, 10 no, 33 maybe. Number 4, do you feel if you were recorded on a body-worn camera that you would have the right to view that video upon request? 96 responded yes, 3 no, 6 undecided. Number 5, should a deputy be allowed to view their own body-worn camera before writing their reports? 59 responses said yes, 34 people said no, 12 were undecided. Number 6, do you believe that all police interactions with the public should be recorded with a body-worn camera? 68 responses said yes, 22 said no, 15 were undecided. Number 7, do you feel that the behavior of a suspect would be improved if a police officer was wearing a body-worn camera? 43 responses were yes, 40 responses were no, 22 undecided. Number 8, do you believe that if you have been been recorded by a Morrison County Sheriff's deputy with a body-worn camera, that any member of the public should have the right to view that video upon request? 9 responses were yes, 30 responses were no, 2 undecided, and 64 responses were depends on the nature of the incident. Number 9, do you feel that citizens should have an expectation of privacy while in their home and that those recordings should be considered private? 28 responses were yes, 12 responses were no, 4 were undecided, and 61 responses depends on the nature of the incident. Number 10, do you agree Morrison County deputies should be required to have their body-worn camera on while inside someone's residence? 64 responses were yes, 1 no, 2 undecided, 38 depends on the nature of the incident. And number 11, have you reviewed the Morrison County Sheriff's Office draft policy on the use of the body-worn cameras? 65 responses were yes, 40 responses were no. And then there's questions and comments, and like I discussed, we reviewed all of them. They were all positive. Positive comments from the community members saying and/or agreeing that law enforcement should have body-worn cameras. So instead of going through every single one, it's there for you, and if there's any questions at this time, we can take them in regards to the survey.
Anybody got any questions?
I have question 4, 8, and 9. I just want to know what that real answer is.
So
Opinion.
let's go back to 4.
I had 4 down too.
All right, so number 4, do you feel that if you were recorded on a body-worn camera, that you would have the right to view that video upon request? So I guess what I'm interpreting is that if I'm going to a call and Amy is involved in that call and she's being recorded, the question is, do you think that you would have the right to view that since you were being recorded?
Yeah.
And there is with body-worn cameras, it is private data. However, if she's directly involved, and as long as there's not a current investigation that's taking place, And if she would submit a data request, then she would have the right to see that video, if that makes sense.
Yep.
The next
8 and
question, okay. Number 8, do you believe that if you had been recorded by a Morrison County Sheriff deputy with a body-worn camera, that a member of the public should have the right to view that video upon request? And I think what that means is,
That
so,
anybody,
so anybody could see that video that I had with Amy Mittendorf. And again, it would be considered private data, so they really wouldn't have the expectation to even see it unless they were involved. Does that make sense?
yep,
Okay.
that's what I figured it was, but I didn't.
Number
Mr. Chair-
9, I'm sorry.
Mr. Chair, if I can ask a question in relation to that. So, so your answer to that is really that's, you know, this is private data, this is private information that, you know, belongs to the sheriff's department. So where does the carriage get unhooked from the horse in the sense that when an incident occurs and we have legal action taken? In other words, we have an incident that requires judicial action, and now we have a court case, and now that body camera video becomes public.
So, yeah, that's a good question. So a lot of
we
it,
have a case right now with a peace officer in the North Metro that you know, kind of a very defining part of that case is the fact that body camera video is going to play a major piece in that case. Where is that point in time, or where is that fulcrum where all of a sudden this is no longer private information, private data of the police, of the peace officers, and now this becomes public?
so a lot of it kind of depends on what's the nature of the incident itself. Is there a public safety risk, if you will? If there is a public safety risk, then per policy, we're able to share it with the public as well. So I'll just go over a couple points in our policy regarding public data. It says data documenting the discharge of a firearm by a deputy in the course of a duty other than training or killing an animal that is sick, injured, or dangerous. Number 2, data that documents the use of force by a peace officer that results in substantial bodily harm. Again, under public data, data that a data subject request to be made accessible to the public, subject to redaction. Data on any data subject other than a peace officer who has not consented to the public release must be redacted. In addition, any data on undercover deputies must be redacted. Data that documents the final disciplinary action against a public employee. However, in another provision of the Data Practices Act, classifies data as private or otherwise not public, the data retains that other classification. For instance, data that reveals protected identities under Minnesota Statute 13.82, certain victims, witnesses, and others should not be released, even if it would otherwise fit in the public categories listed above. So we have to follow policy and procedure, but again, if it's a public safety thing, we can make that call as well, that this needs to get out to the public because it could help somebody, and it would do more good if it was publicized, if that makes any sense.
Okay.
Mike, did you have all your questions answered?
Just 9.
Number 9, do you feel that citizens should have an expectation of privacy while in their home and that those recordings should be considered private? So in other words, I come to your house, there's some instance, and because it's inside your home, should that be allowed to get out? Is what that question's really
Yeah.
talking about. And Basically, 61 people are saying, or 61 responses say it depends on the nature of the incident. So, can I help you expand? Just ask me a question, I'll try.
Just that, so if you go in someone's home, when, or will, your cameras will always be activated, right? When you're, if you're going to someone's home, obviously they should be, because it's for your protection and to back your story up, to have your camera on, but if there's nothing that happens, that will stay private,
Correct.
right? So they do have an expectation of privacy unless it is something that counters a claim against your officer, or if your gun is pulled, of course.
Correct, correct.
So
And
they
the
will
only,
have privacy in their home.
yep, and the only person that would have a right to that, unless it was a public safety issue like we
Yep.
talked about before, would be the people directly involved in that complaint or who were at that residence because of that call that officers responded to.
Thank you, Sheriff.
Mr. Chair? Sheriff, if I can follow up on that. You're driving down the road and you have to go to the bathroom, and you know where I live, and you drive into my yard, and you stop in, you knock at the door. Maybe you want a soda, a drink of water. Is your camera on? I'm asking the question.
Well, am I responding?
You are
code?
coming to my house to say, Jeff, you got a drink of water? Can I use your bathroom? Is your camera on?
In that instance, no, it wouldn't be, Commissioner.
Is no?
Correct.
Which is absolutely correct. But if you come to my house because my wife called you and said, Jeff is beating the hell out of me, is your camera on?
Yes, it would be, Commissioner.
Automatically, period. There's not a question it's gonna be on.
Correct.
But if you're coming to my house because, you know what, I know, Jeff, I need a drink of water, I have to go to the bathroom, I have to comb my hair, whatever the case is, your camera is not on.
Correct.
Thank you.
But if I can clarify and add to that. So basically, at any time, if we have contact with somebody in the public, if there starts to be an altercation, they come up to us and they're just talking and asking questions, now there's an altercation, or there's, maybe there's a little bit of anger, things of that nature. Per policy then, I'm gonna activate my camera to record that, to make sure the incident is covered and recorded, which obviously would protect the officer as well as the person involved. So both situations, we have an accurate understanding of what occurred, if that makes sense.
Mr. Chair, if I may follow up on that question. So you as a peace officer have to make that judgment whether you turn it on or off unless you pull your firearm or whatever. So in this case, you're going to the house for a domestic. You may decide, you know what, it may not be that bad, so you as an officer still decides whether you're gonna turn that on, is that how it works?
So Commissioner, in that case, if there's an actual event, why we're responding, if there could be if there's like gonna be a potential criminal charge that comes out of this, that recording has to stay on from the beginning throughout the end of the duration.
Beginning,
So in other words, if I get a call, I'm at the sheriff's office, and there's a domestic at somewhere in Pike Creek Township at a residence. As soon as I activate my squad car camera, my emergency lights, and respond code to the incident, my dash cam is activated, and so is my body worn camera at the same time. So per our policy, both cameras need to continue to roll during the entire duration of that call until I make an arrest. It's not until they get back to the jail till I can stop the recording. Or if I don't make an arrest and I just clear the call and no one goes to jail, then I can deactivate my camera. But it's not, it's the entire duration. We can't stop it just in the middle of a call, if that makes sense.
that clarifies it. And one more point, so again, you see on the news, where an officer didn't record their, the situation, whether it is because again, by what I'm thinking is that they had that, choice. So if you don't activate your lights or anything like that, you're going to whatever, maybe, maybe a burglary. So whether you activate it or not. So that, at that point, you still would have to activate it manually if you didn't and turn your lights on? Is that how that works?
Correct.
Okay.
So if you went to a call where there's no, you're thinking, well, there's not a potential for a crime here, it's just maybe a civil complaint, and you get there, you're not required to activate your camera. However, if someone comes out and now they discuss something with you, and again, we got that anger, or they start making threats to you, anything in that nature, then per policy, we're supposed to turn it on.
Clarifies that, thank you.
Mr. Chair,
Commissioner Jelinski?
if I can just continue on this path. You and Doug decide to go to Joe's Cafe today at noon because you're gonna take a lunch break, and you do take a lunch break. And you visit with whomever's in the cafe. And on your way out, I meet you on your way out and say, hey, guys, what's happening today? Anytime during this time, your camera's activated?
We weren't called to
Nope,
the
you went
cafe
to
for a
lunch.
crime.
You went to
Okay.
lunch,
So
and I
you-
met you on the way out. Hi, how you guys doing?
So in that case, Commissioner, we would not activate our cameras.
Thank you.
Commissioner Blaine?
So, is there at any point in time in your work or in your service where you're required to tell the public that your camera is on?
So that's a good question, Commissioner. We're not. However, if they ask us, we're gonna tell them, yes, you're being recorded. But per statute, per policy, we do not have to say, hey, we're responding to this domestic, we're here, you're being recorded. We don't have to do that.
Okay, and so if I may, Mr. Chair, follow up to this and probably more, so we're talking a lot about the benefits or the process and procedure of having the body camera on. Do we have protection, legal protections, where if we end up in litigation and the body camera was not activated, that you don't get sucked into some level of liability there because you didn't activate your camera? You know where I'm going with that?
I do, Commissioner. So for the most part, the way this is laid out, your camera is gonna be required to be activated. I'll just go through the policy, it might clear up a few things. Traffic stops, any type of traffic stop we get, camera's gonna be activated. And that means dash cam as well as body worn camera. Priority response, anything that, whether it's a medical situation, an alarm, things of that nature, not necessarily criminal, but it's still a priority because we're gonna go lights and sirens, so that both cameras would be on. Vehicle pursuits. If we get a complaint of a suspicious vehicle in the area, normally, right now, you're just gonna start looking for the vehicle, and if you find it and make a traffic stop, you would activate. Well, per the policy now, suspicious vehicle, your cameras would be activated. Anytime you do an arrest, anytime you do a vehicle search, anytime there's a physical or verbal confrontation and/or use of force, so that's kind of what we talked about before is, you might be at the cafe minding your own business, and we're not required to record that conversation and/or my partner or the citizen across the table from me, but as soon as someone comes over, and if time permits, and I know that they're angry, they're upset, maybe they start threatening me and/or our agency, per our policy, I'm supposed to be activating it. And I can go on and on and on, but this camera is recording technically 24/7. However, there's only certain times that I'm gonna actually activate the camera. So to get to your point, if we need to, and there's an event that transpires, and for some reason I didn't have time or I didn't activate it manually, I can still go through some different loops to try and get that footage if I can, but that's above my head and that would be through Axon.
So, if I may, Mr. Chair, so and I understand that, and goes back to, you know, the benefits of having all of this activity on camera, on film. Where I'm going with my question is, we've seen in the past societally across the country where there are times where there is no body camera footage, where the peace officers have that technology, but for whatever reason, there is no body camera footage. It's off for some reason or whatever. Where I'm going with this is, if that happens, just because you have this technology, is the expectation by the public that everything is recorded all of the time, and if it's not, it allows the public to somehow hold you legally accountable or put you in a precarious position that way legally, because you were at this call and for whatever reason your body camera is not on. You didn't activate it. You made a conscious decision to not activate that. You were at the cafe and all of a sudden what was mild conduct escalates into something that turns violent. You didn't activate, your officer didn't activate his camera immediately or in time. Incidences happen that weren't recorded. Does that give the public the opportunity to come after you and your department because you had that technology and it wasn't utilized? And you see where I'm going?
Sure.
And we have our county attorney behind too, if he would like to comment on that also, but maybe you can cover this for me.
I'll cover what I can, and then Doug, if you want to expand on it. So there's reasons why sometimes camera footage doesn't work. Whether it wasn't charged properly, maybe the deputies have an issue, with their body-worn camera, things of that nature. So what we've tried to do is look at all of the policies that are out there regarding this and try and implement something that's going to help us so we don't have these things in nature like you're talking about. For instance, everybody's supposed to check their body-worn camera prior to the shift. Make sure it's functioning, make sure it's charged properly, and ensure that it is before they even actually start their shift. If not, they're supposed to get a hold of a supervisor, and the supervisor then is going to give them a spare, which we purposely purchased for things of this nature. Yes, per policy, we're going to be following policy, but there's just no way to record 24/7 when I'm having lunch, whether it's with Doug or whomever, even a trusted citizen, there's just no way to always just keep this thing activated, because there's things in our personal life that we may have to take care of at some point, which comes into actuality or factual basis when we're looking at this. So, but I know where you're going with this, and for the most part, it's laid out that we're supposed to do this. However, let's say where there's an ambush, and at some point it's like, you know what, I had no chance to actually manually actuate my recorder. The good news is I can still push that button when it come to my senses to try and figure out what happened when I was having lunch with somebody, and it'll go back, and you gotta help me out. I don't remember how far back the recording will go.
We can set parameters, it's my understanding, like right now, if our squad car camera, like if I would run out the door today and get my squad car, hit the lights, it goes back 30 seconds. You can go back 5 minutes and it'll record 5 minutes. The 5 minutes or 30 seconds is not sound until I hit the lights, and then once I get going, then the sound will come on, the audio will come on, but it'll have a picture. You see it quite frequently, like if I'm at my desk and there's a hot call, I go running out the door. The first 30 seconds to a minute is just my squad car sitting there, and then it'll trigger. When I trigger the lights, it'll come on. That's the same with the body worn cameras and our squad car cameras. If I hit the button, it'll backtrack whatever we set it at. 30 seconds, a minute, 2 minutes, it'll backtrack. There will not be any sound until I triggered it, you know, so you'll get visual, but no sound until I trigger the device to turn on. I hope that answers your question. You know, we have to revert back to our policy, so I will put myself on, if I come and have interaction with one of the citizens of Morrison County and it's normal, and then it becomes physical or verbal, and I didn't get it turned on in time, that resorts to me, but it's gonna be a case-by-case basis. Why didn't I get it turned on? You know, was he within my 6 feet of me? You know, things happen like that, so fast. And also, it's a computer, basically. It's a computer that, you know, you could be working on it, it could be working today, and the next thing you know, I gotta call Amy or her staff. My computer don't work, and it worked fine 5 minutes ago, you know? So we kinda keep watching them and keep checking them all the time.
So Brian, you know, you're here with us, and I'm glad that you are, and I think you understand what I'm saying. If we would utilize this technology and engage in utilizing this technology, you know, for the benefit of the police department or sheriff's department, benefit of the public, does it also open up the window to say that we could be involved in litigation because at some point in time there was something not recorded? That's where I'm going.
I think I understand your concern, and so body cameras are not required by the law. This is optional technology that we're planning to implement in the county. So if a deputy fails to activate a body-worn camera when they are required to under this new policy, it's a violation of the policy, it's not a violation of the law. And so if they violate the county's policy, that may involve some discipline within the sheriff's office, but it wouldn't be a violation of the law. Now, if we go to court and a defendant, say, challenges the fact that there's no recording in violation of policy, it may go to the weight of the evidence or to their credibility, but it would not affect the case. In another way, they would still be able to testify as to what happened, just that there's no video of it.
Thank you, Mr. Chair.
Okay. Just for clarification, now this information that you showed us this morning, all that is data that came back from Facebook and stuff out of the request. This is not implemented. We go by our policy. I think you're showing us that, showing that there's support out there.
Correct.
For that, correct?
Correct,
So, I
Mr.
mean,
Chair.
those numbers don't mean anything to your policies and stuff. This stuff is all going to be ruled on policy.
Correct.
Okay.
I think we just have one more slide, and then I'll turn it over to the board.
Okay.
So we'll just read the statute, and then we'll kind of turn it over. So implementation of body-worn cameras, the statute number is 626.8473. Subdivision 2 is the public comment. Local law enforcement agency must provide the opportunity for the public comment before it purchases or implements the portable recording system. At minimum, agency must accept public comments submitted electronically or by mail, and governing body and jurisdiction over budget of agency must provide the opportunity for public comment at a regularly scheduled meeting. Then subdivision 3, written and procedure mandated. The chief officer of every state and local law enforcement agency must use the purpose of the use portable recording system, must establish and enforce a written policy governing the use. In developing and adopting policy, agency must provide for public comment and input as provided in subdivision 2. The use of portable recording system without adoption of written policy meeting requirements of this section is prohibited. Written policy must be posted on the agency's website if the agency has one. And that's everything that we did do and we followed. So with that, I'll turn it over to you, Mr. Chair.
Okay, we're going to call the meeting a meeting's called to order for the public hearing, and now we're going to have a description of the issue? And is that what you just presented? Okay. This meeting is open for public comment and questions. And I will ask 3 times if there's anybody that has any questions. Does anybody have any questions? Does anybody have any questions? Does anybody have any comments or questions? Do we have any mail-in written comments that need to be read into the record?
We do not.
Okay. Then the public comment period is closed. Now we'll take action on this.
I'll make a motion to approve, Mr. Chair.
Got a motion to approve by Commissioner Lemire,
Second.
seconded by Commissioner Lazinski. Is there any further discussion? Lazinski.
I like it.
And I'm the one asking.
I caught myself, Jeff. Randy, go ahead.
Okay, thank you, Mr. Chair. On these surveys that were done, is that for Morrison County residents only, or if I'm from New York, or if I'm from whatever, could I make a comment on that and kind of sway it one way or the other?
Yeah, good question, Commissioner. So, yeah, technically, it's posted on our website, so we can't monitor as far as who's actually taking the survey. So you're correct, it could be anybody from out of county, in county, out of state.
And
Yes.
again, one last follow-up, again, with your public comment, and I appreciate that. You know, we see where we're at here, because again, it seems like we didn't have any public comment today, and I think that's a good thing, so.
Okay, does anybody else have any other questions?
Mr. Chair. Gentlemen, the resolution was not part of your packet today. It is displayed for you in front of you on your monitor, the full resolution.
That's for the source well.
Okay.
Oh, I'm sorry.
Excuse me.
I thought it was,
That's for number 2.
I'm sorry, I apologize.
And if I may, Mr. Chair, again, I apologize. This vote, maybe you.
No, I want to ask the same question.
Go ahead, Mr. Chair.
What's this vote on here? Is this to do the cameras?
Oh,
Okay, this is just the public hearing
just the public
procedure
hearing.
was done. Okay.
Yes,
that's-
Mr.
I just wanted to clarify that, because we got more questions about the other stuff.
Yeah, we'll be coming forward again. Do we have the date? December 21st, Mr. Chair. And at that point, we'll be answering every single question you have before it gets a final vote.
Sounds good. Okay, we have a motion and a second. Is there any other questions? Commissioner Blaine?
So, Mr. Chair, can you clarify, this vote is we are voting whether to go forward with this, or?
That we had the public hearing. I think that's what this vote is on, that we did our public hearing. Am I
Yep,
correct?
just that the public hearing, per statute, we had to have a public hearing, so everybody's in agreement that we have allowed the community members to come forward and make any comments towards the body worn cameras if they wanted to. And now we're just gonna be moving on to our next step, but taking a vote that we're okay with this for our next step.
My vote is to move forward with the process.
Right. Okay, are there any other questions? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
All right, thank you.
Thank you.
Have a great day.
Thank you, gentlemen.
Thank you all very kindly.
Thank you. Yeah, the Sourcewell one?
Yeah, it's not listed on the agenda separately, so, I don't know if you wanted to introduce it, or, okay. So hi again. It's not listed out separately on your agenda, but we do have a resolution that we're bringing forward today to authorize us to apply for the Sourcewell Community Match Fund for local government's grant submittal. It's a match fund that Sourcewell provides to counties and cities in their region, and Morrison County is entitled to one community match fund. And so I'm asking for the board to approve Morrison County Sheriff's Office to apply for the funds of a match up to $10,000, and we will utilize the funds towards the body worn camera program.
So moved.
Second.
Motion by Commissioner Jelinski, seconded by Commissioner Lemire. Any further questions? Commissioner Winchard.
Mr. Chair, I would request that Amy read the resolution, please.
Okay,
Would you like me to do that now?
yes, go
Okay.
ahead.
So a resolution supporting and authorizing a Sourcewell Community Match Fund for local governments, grant submittal, and commitment to match amount awarded for the mobile video recording project. Whereas Sourcewell has a grant program that offers match funds for the cities and counties in Region 5. And whereas the County of Morrison is the sponsoring agency submitting a Sourcewell grant application. And whereas the funding requests have to show a public purpose and benefit the region. And whereas the mobile video recording project will allow the opportunity for law enforcement in Morrison County access to the same level of service for interacting with our community. The project will provide officer transparency, accountability, evidentiary proof, public confidence in law enforcement, and enhance officer training. And now therefore be it resolved that the Morrison County Board of Commissioners authorizes Sourcewell Community Match Funds for local government's application and are committed to match the amount awarded for the mobile video recording project. I don't know if I have to read that bottom part.
No.
Okay, does anybody have any other questions? I just want to, I want to thank Sourcewell in the fact that they do this. Our 5 counties are the only counties that are allowed to be able to do this stuff. And so I do want to take the time to thank Sourcewell for allowing that to us with all the other funding that they give us too. So, okay, we have a motion and second. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you.
Thank you.
Thank you, everybody.
Thank you all very kindly. Appreciate it.
Have a good day.
Hesitated because I seen that there, but it wasn't on here.
Good morning,
Okay,
Mr.
good
Chair. Good
morning.
morning, Board. Good morning.
Social service report, good morning.
Yes, Melanie is here to talk about one of those critical functions that County Human Services provides, and that is children's mental health case management.
Thank you. Good morning, Mr. Chair and members of the board.
Morning again.
I want to just give you a brief overview of children's mental health case management and kind of what we focus on, and then some of the new initiatives that we're looking at. So Children's Mental Health Services is a service that's available for children that are diagnosed with a serious emotional disturbance, and it has to be given to them by a qualified therapist. And we do serve those kids up to age 21. So it's kind of a unique service in that way because adult services have a higher level of threshold to get through. So we extend that children's eligibility to help get youth through those transition years, which can be important as that can be a very trying time for them. So, and it is a voluntary service, so families agree to this service and sign an application for it. It's not something that we impose upon families or youth. It's really directed at providing support and education and service coordination for those kids. We're really focused on wanting to help families and kids understand the mental health issues that they have and what their symptoms look like and how they can best manage them so that they can be productive citizens. That's our overarching goal. We want these youth to remain in our community and become productive citizens that are working. A lot of the kids we are serving do have pretty serious traumatic instances that they've had in their past. We see kids that come out of the child protection system, maybe in our county, maybe from other counties, and they're adopted. And we have a large number of kids that have been adopted out of the child protection system that we serve as well. Our caseloads kind of remain at that higher level, not as high as they were back in 2018. COVID really impacted our applications in 2020. So they went down, and now we're kind of coming back up into a more normal status that we've had. I know there's quite a bit in the news about how COVID has impacted children's mental health. We do see that to be true. I do anticipate that we'll continue to see applications. Probably the thing that worries me most about the impact of COVID on children's mental health applications is that there's been a delay for kids to access services. And so now when they're coming into us, their issues are a bit more severe. And so that's really the largest impact, that kids and families have been waiting, and they're coming in at 16 and 17 and with some pretty serious problems.
Excuse me, Mr. Chair.
Commissioner Jelinski.
It's quite obvious this is not going away.
Right.
SED, this isn't something brand new. If we look at the numbers that you provided us from 2018 to the current, the numbers are the same. It's not going away. If it's doing anything, I mean, we still have the month of December in '21.
Right.
It's going up, if it's doing anything at all, so, thank you.
Yep. The next slide is really about our continuum of care, and I've showed this slide before, and it's just kind of represents, you know, where kids start out with outpatient services, and when they have an emotional disturbance, and then once they are have at a level where they're severely emotionally disturbed, and then the continuum of services that can go, things that can be provided. Most notable is that we are increasing our access and building services midpoint and beyond with CADI services, Family Support Grant, and also looking at our new initiative, which I'll talk more about, Collaborative Intensive Bridging Services is also on that angle, on that farther end of the continuum. We are one of the counties that use the waiver program for children with mental health concerns. Not every county does, but we've really been seeing a benefit to that. Really building the services in that family training and counseling area under the CADI waiver to keep kids from the furthest end of the continuum that is placement. So really trying to keep them in their home. So this is just a slide that kind of represents that. I have a couple different slides that will kind of show that growth. This is that growth in that waiver service. So in order to be eligible for the CADI waiver, a child has to be on medical assistance and has to have either a state medical review team has to say that they're disabled, or their application for Social Security. They then have a min-choice assessment at a Sarah Pratt's unit with the min-choice team, and if they're found eligible for CADI waiver, then they start CADI waiver services, and we provide CADI waiver case management under the umbrella of Children's Mental Health, because as we see that, CADI waiver is just a service under Children's Mental Health that we can offer. So we bill a different source, and we can every activity that we do under the CADI waiver is billable, and that's good, because those kids that are on that higher level of need require much more time and activity from our social workers. So, and then we can access services that we can't access otherwise, and those services are not then paid with county tax dollars, they're paid with state and federal waiver dollars. So we're continuing to build that area of our program. Kids can come on and off the waiver much more frequently than adults do. So we're always managing that when they come off the waiver because they have to enter into a hospital or a setting. Let's say they end up in trouble with corrections. That's happened recently. And they end up in a 30-day placement with corrections. We have to stop billing the waiver. We put them on child welfare case management quick. So we're always trying to account for our time in billing. We're figuring out that system of going back and forth. So the next slide is our children's mental health treatment settings I wanted to show for all child welfare. So child protection, truancy, adoption, guardianship kids, and our children's mental health kids in different settings that we're using and the trends with that. Unfortunately, despite our efforts at trying to keep kids in the community, residential placement continues to be higher than I'd like it to be. There are times that we just do not have any other options in order to keep kids safe. We've had a lot of suicidal ideation and violence, and those are the times that we end up in those situations. Or sometimes we're just not able to figure out an accurate diagnosis on the child, and then it's really hard to come up with a treatment plan, and so then we might access a 35-day residential assessment for that. And so that would count under that column, even though it's not a long-term placement. The newest bar graph on there at the end, and I missed putting a 5 over it, is extended foster care in 2021. So, as a result of the increase in focus on stay services, which are, those transition services and that stay grant, a lot of push of notification of kids that are in placement or have been in placement are eligible for extended foster care. So if they age out of foster care, which happens for some of our mental health kids, they can take part in extended foster care as they transition to adulthood. And so we've had 5 youth doing that. Out of our children's mental health caseloads, and our children's mental health workers are managing those cases, and they are making great progress and getting jobs and getting into their own apartment. And so it's, again, bridging that level of support so that kids don't, when they're at those critical ages, don't all of a sudden end up in a mental health crisis and then in a hospital in the adult unit. We're working hard to try to keep diverting kids from the adult mental health unit as well if we can. So the next slide is just, again, another illustration of that, but just for children's mental health clients, what their permanency status is. So I want, in a mental health setting, just 1 truancy youth, 5 state wards that we're serving under mental health. By and large, most of our kids, as you can see, are from families in our community that are accessing placement in order to support their kids. They're connected with their kids. They haven't abandoned their kids. It's their decision. We're working together on a treatment plan. And then 5, again, in extended foster care. The next slide just kind of gives you a picture of how things shake out financially for the different cases that we have. You know, we do promote children's mental health, especially with younger kids. The younger we can start serving kids, the better outcomes. We can actually close their cases. And so, you know, we're always hoping that our growth would be at those younger ages. And so, because those kids are at that moderate need, and we can intervene much quicker with better outcomes. Placement is a high-cost service. We're always trying to come up with ways to divert that because of cost, but also because it's traumatic for kids to leave their home. So it's really the least best option. As you can see, CADI waiver, although we provide a high degree of service, there's not a lot of county dollars that we expend on a case that's CADI. The next slide just shows our TCM rates, our target case management rates. It is it's some kind of formula.
It's a monthly rate. They
Yeah.
determine it by our cost pool, our number of staff, our number of cases, divided by a percentage, so.
Right, we
it's-
always try to do our best that we can to influence our rate, but we only have so much control over it, so. But, you know, we'll keep working at it. The next slide just shows our different areas of revenue that I do use for children's mental health services. The billing for case management comes under CADI, MA, targeted case management, and PMAP, CADI, targeted case management. Our PMAP amount has went down over the years, and that is really because we're putting more kids onto straight MA so we can get them into CADI, and a high use of family support grant. They also have to be on MA. So that has been a change. The family support grant has increased quite a lot. Screening grant has increased quite a lot. That's really a benefit our child welfare team does that helps our children's mental health services. So when they screen their kids, we get credit and financial credit for those screenings. So, but our respite grant unfortunately has went down because most of the more counties in the state have applied for it, so our grant went down, even though we continue to expend at our regular rate with that.
Just one other comment about the CADI funding, and as you might recall, the cost reports that Jim and I bring in generally annually, but it's been a little longer. That CADI revenue is part of that overall report, that $100 million that is, that we expend, even though it's not very little county dollars.
The next slide, just I wanted to kind of show a picture of the 2 areas I'm trying to work on with services and budget that have 2 positive impacts, because increased services and options for families is a good thing, helps kids stay in the home, but it also, we've brought that revenue in from other sources other than county tax dollars to do that. And so you can see our CADI waiver has increased, you know, quite a bit, especially this past year. And a lot of that reason is because I've been working on building a service with a community resource that we have locally and building family training and counseling services. And then we've also had an increase on willingness of other agencies to provide in-home support. So staff will come into the family's home and help them parent and provide supervision. So those increases have helped quite a bit. And then the family support grant is available for kids that are in their home, not in foster care, not in a placement setting, but they are, again, the state medical review team has deemed them disabled and they're on MA, and then they can access about $3,000 annually in whatever way they choose to best support their family. And so the workers complete an application with that, and so we're serving a lot of youth with that right now. Sometimes that pays for weighted blankets, it might pay for technology and device, special classes, all kinds of things. So it's whatever the family chooses. So I think we have another increase coming in that grant next year. So that's good. Families are liking that service. So again, just the benefits, again, it's really trying to look at diverting corrections placement, child protection, adult mental health, having crisis mental health situations arise. And we want to give our kids and the youth the skills to function and understanding their mental health concerns and learning how to cope with them. You know, a lot, the challenges we're facing really is, you know, there's just not been a growth in state funding. There's really not been a growth in state services or ideas they've had, or the ideas they have had are very metro focused. So we've really had to kind of do our own thing out here. So the COVID has really impacted waiting lists as well. And then kids just having way too much time in front of the computer. And then was in telehealth, trying to do telehealth with a kid that's already done school. I mean, that's why we're seeing some of the needs be so increased at this point. Let's see, and the last slide, just talking about some of the new initiatives that I've mentioned. You know, we're having a lot of success with some of the trainings that I've invested in with our unit, and our unit, the social workers, so impressed with them. They really, and when you send people to training, you never know what they're gonna get, right? Well, staff went to training last year and they just gobbled it up, and they turned around and have implemented some really cool stuff and interventions that talk about self-regulation and movement and things that kids and families can actually do to have an influence. So that's been really positive. Our work on trauma-informed care is paying off because we're able to really do better person-centered planning and engagement. Families and kids feel more heard, so they're more likely to engage in their treatment planning and their services. So there's some really good results with that. The Region 5, another Sourcewell grant that we applied for last year, we did get, and so that's helping us build this new service that's called Collaborative Intensive Bridging Services. We brought that here last year. We're in the middle of training for that and getting our mental health providers, and so the numbers out of that service and other counties is really good at decreasing the need for residential placements, and we're really hoping it will have that impact here. So hopefully that will start spring of 2022. We've been working a lot with making those connections for kids of their family and their community, and that has also provided a lot of supports, especially those transition youth I was talking about, really working hard to connect them to community members and family and friends so that when they do have a crisis later and we're not there, they have people to reach out to that hopefully will not end up in the adult mental health unit. And then our use of CADI waiver has just increased so much in that development of that new service.
Good, thank you. Does anybody have any questions? Randy?
Thank you. Melody, you keep on stating, you know, that this is a success, and I'm so for children's mental health. I mean, there's a lot of things I don't want to go down that rabbit hole, but this is, to me, is a short term, you know, from 0 to age 21. How do we define a success after age 21? There seems like to be no other statistics for that, so if I'm on Medicare or whatever it may be when I'm a child, but to me, the long term should be the most important one because and again, I know you guys do a great job, but to follow up with this when somebody's 25 or 30, are they homeless? Are they whatever, have a great job? And those things I feel is important as for your confidence, say, hey, look at Jane Doe, she was part of this, and now she's got her own business. See what I'm saying?
I do. I've thought about that a lot, actually, especially when I was putting this report together. I thought about that a lot with our stay youth, too. The problem is data privacy, and I can't track them down again, you know? The only thing I can do is look at who ends up in adult mental health. That's the only data I have access to. So, and corrections, you know. That's about it. And that, I can't even access corrections. I can only see who's on the jail roster.
Yeah, and I say,
And to some degree, going into adult mental health is a success because they continue to need that support, given the disability that they have. And so,
Yeah, it's hard to, I guess what I determine as successes is because I do the consultations with staff, and I meet with them every month. And so when I talk with staff, and we talk about their cases, and we have a clinical supervisor, are they reaching their goals? Are, you know, and I can say I've been around for a while, unfortunately.
Very fortunate, not
Fortunately.
unfortunate.
So it's really cool. In some ways, it's a really good thing because we have people that will come back to our workers and say to them, and I know that's anecdotal.
Yep.
And, but I would love to be able to do that, but I just can't seem to find the way to really track that because of data privacy.
thank you.
Commissioner Blaine.
Melanie, thank you. It's a very good report, and it's comprehensive, and it's complete, and it's important. I do have a question kind of along the lines of where Commissioner Wincher was going, but you talked about, you know, this program is 0 to 21 in age and the importance of the early intervention. But I'm curious of the percentage of these children that we identify at whatever age. You know, do these clients ever leave, you know, mental health case management before they age out at 21? You know, if we have intervention, let's say, with with a child at 5, you know, do we have statistics that say that X% of our clients we're able to help them get on top of that mental health management, and they are no longer clients before they age out at 21? Do you have any idea
Oh,
what
yes.
those numbers would look like?
They're annually run very close, about 30 to 40 a year that turn over. So
30 to 40 individuals
Yep.
out of the 170?
Yep.
Yeah, okay.
and again, it's not that, you know, a lot of these families just need some support, some services that can help and support the work that they do with these kids, because they're gonna be probably challenges along the way, whether we close at 12 or 14 or 10. And so it's really incumbent upon the staff, and what they try to do is build in those supports so families can function independently with what's available. And so,
I would say the majority of our cases stay open for 2 to 3 years. By far the majority.
Oh, really?
Yeah. Well, and maybe, I wouldn't say that. Let's go back. I would say 2 to 5 years. I always talk with staff, and we were just talking about this the other day, and what I see is it takes a lot of patience, because these kids are not just emotionally disturbed, they're seriously emotionally disturbed, and that takes time to work through that. But most do not age into adulthood with us. They end up usually closing in the upper high school age, and they're getting ready to be on their own, and things have kind of sorted out as much as they can, unless they're on that far end, because again, we have this range of severity we serve, those kids that are on that far end of severity stay with us, and we work with them either into adult services, or they stay with us till they're 21, or we access that extended foster care pathway.
So this, I've run across this public perception where if there's individuals who access, let's say, mental health management at, let's say at 6 years old, that they will continue to be serviced by the county till they age out at 21. That's not the case. We are seeing success within this program in that 2 to 5 year range, where that's our window in most cases that we're able to help these people sort through those issues.
The best case openings happen in elementary school. They're the shortest duration, because again, it's always early intervention.
Yep.
And of course, there can be those circumstances where there's a very significant mental health, and that's, and they
Yep.
are gonna stay with us, but usually, if we can start in elementary or even younger middle school, it's just, you gain traction so much faster. Yeah, the hard part is when you're starting services with us at 16 or 17, then that gets difficult, then we've a lot more stuff to unpack.
Thank you
Yeah.
so much.
I want to thank you guys. I've sat on the Sourcewell board, and every year, it seems like Brad and Melanie are there presenting programs to people. And they've been given the funding the last few years to develop these programs. And it's not only programs in our county, but you're also involving the other 4 counties. And I want to thank you for all the work you do, because you do great work with the money you receive. And it's not only benefiting Morrison County, it's benefiting our partners in that too. And I want to thank you, because not everybody comes and does the work that it takes to do this. And you've seen great results, so.
Well, and Melanie gets all the credit for the Collaborative Intensive Bridging Services grant and the process and building that program in Region 5, because it is hopefully one of those services that will help us reduce those kids that go into out-of-home placement, will build better supports for families. And Melanie's worked her tail off in writing that grant, working with our provider community, working with the other counties, and so she's done a great job with that.
I just want to thank you. Does anybody have any other questions? If not, we thank you very much, Melanie.
Thank you, thank you.
Melanie.
Thank you.
Next, Public Health. Cindy?
Cindy, I think, is here.
Yes.
So again, this is one of those programs that can help maybe divert kids from what Melanie was just talking about. If we can get in even younger and support some of our families as new parents, we will hopefully even do better in making our families stable and successful.
Good morning,
First of
Ms.
all,
Lord.
Morning, Cindy.
welcome, Cindy.
I'm here to talk about the pre-Melanie, so I probably should have been in front of her on the bill, but I'm here to talk about the Family Home Visiting Program, if you want to go to the next slide. So the Minnesota Department of Health has definitions of what a family home visiting program in a county should look like. And basically, there's 3 steps. We need to be assessing the needs, we need to take that information to develop programs, and we need to advocate for programs and funding streams. And by advocating, in our case, that means that we are often applying for grants so that we can continue to do the work. Next slide. So locally, our maternal health child nursing program is focused on outreach and service coordination for hard-to-reach and high-risk populations. And that's a very broad term. That might be young moms, it might be moms that have chemical dependency, it might be moms with mental health, it might be moms that are lacking in understanding of how to be a parent. A big focus for the program is community health promotion. So we want to make sure that those families are getting to clinic appointments, that they're following up and doing what they need to stay healthy. In the last 13 months, we've transitioned to using the Maternal Early Childhood Sustained Home Visiting Program, which is called MESH, and that we will talk about in a little bit greater detail on the next slide. So the MESH program started in Australia. It transitioned here to the United States with pilot programs in Vermont from 2003 to 2007. And in the last year and a half, it's really exploded across the country, and Minnesota has really gotten on the bandwagon. I believe that we're at over 50 counties that have transitioned to using this model. This is an evidence-based program that allows us a lot of flexibility. The previous evidence-based program that we had only allowed us to work with first-time moms, and we know that not everybody is an expert by the time they have their second, third, or fourth child. So this program allows us to take in moms all the way across the spectrum, whether it's one child or 6 children or what have you. This program also has a much more cost-effective training, so we're no longer having to send people out of state. We can do the training here in Minnesota. A big element of maternal child health visiting is that reflective supervision. This is difficult work. It's hard to keep nurses because the burnout is high. You're dealing with people that are struggling. And every day is a struggle sometimes with the nurses. They come back and tell me some stories that are pretty hair-raising. And so having the ability to have a reflective supervisor, which is not me, it's a different nurse, that does reflection with them on venting, how to move forward with cases, case consultation, and support. So our reflective supervisor is working with nurses in Morrison, Todd, Wadena, and Cass counties. Those other counties are reimbursing us for the work done in those counties, but the reflective supervision is huge. And as a nurse of almost 40 years, this is the only time I've ever worked in a role where we allow reflective supervision. Honestly, all nurses, and we look at the pandemic, should have the ability to have that reflection. It's a debriefing of sorts, and it's an energizer. So it is built into this program, it's required in the program, and it makes a huge difference. And when we talk about the MESH program, it's a relationship-based program. So we start seeing a mom either during pregnancy or within 8 weeks after child is discharged from the hospital. So if a NICU baby doesn't go home till they're 2 or 3 months old, we can still enroll them after that point. Then we follow until that child turns 2. So the relationship is between that nurse and that family, as well as the nurse teaching that family about relationships. And we know that parenting is about relationships, and if we can't teach a parent to first have a relationship with their child, we can't teach them a lot about parenting, because once they have a parental relationship, the parenting moves on. We do enlist the services of an infant mental health specialist. Believe it or not, that's a specialty. And the infant mental health specialist works with our nurses as part of this reflection to talk about mental health in both moms and babies. And that just feeds directly right into what we were just hearing from Melanie about mental health in children. It's an early intervention, it really is. Next slide. In Morrison County, we have 4 public health nurses. One of them does a little bit of work within the WIC program, so she's not full-time in MESH. And one of them is about half-time in the reflective supervision, but she's still part of the mental health or the MESH team. So we focus on those pregnant moms and children to age 2. It's very educational and supportive. We have a curriculum that we follow. There's a very specific laid out plan for frequency of visits. So there's this many visits during pregnancy. After baby is born, it's weekly and more intense until baby is 2 months old, and then it's every other week, and we stretch it out. Part of the role is that it's empowerment. We don't want a mom to become dependent on the nurse. We want the mom to become independent. So we gradually wean them off of the nursing visits. But while we're doing that, it's about helping them build their network. It's actually quite surprising how many moms feel very alone. They don't have families that they feel connected to. They don't have friends that they feel connected to. They may or may not have employment. So helping them build that network, because when they graduate from our program, we don't want to drop them off and say, see ya. We want them to have built some relationships. That might be with community partners. It might be that we've got them connected with TCC so that they're with other parents. It might be enrolling them in some funding programs such as WIC or things like that to help them have the support that they need. But again, we don't want to do that for them. We want to empower them to be doing for themselves. So we work in partnership with a lot of the schools, the child and teen checkup. There's just a lot of collaboration with all of the agencies in our counties. Next slide. So MDH does require that we also do some follow-up on people that are not necessarily enrolled in MESH. That might be a child with special needs, a birth defect, a hearing loss, or a child with an elevated blood level. Basically, when someone is diagnosed at birth with a birth defect, a hearing loss, blindness, et cetera, we get a referral from the state. We're required to follow up with them. That doesn't mean that they are required to engage with us, but it's an effort to make sure that those families don't fall through the cracks, that they don't go home with a disabled child and nobody connects with that child until they show up at preschool screening at 3.5. 99% of the time when we reach out to those families, they can give us a long list of appointments that they have and who they're following up with, and we feel like they have connected. It's only on rare occasion that somebody has not made that connection. So those referrals come from the Department of Health. Next slide, our statistics. Basically, this program is funded with grant dollars, and we are getting some levy dollars from the county. There's never enough grant dollars to cover the cost. Our wages and salary is our greatest expense. We're down a little in expense because of not seeing as many people face to face, and we don't have quite as much travel expense, but we're picking that back up. Most of the moms, as long as they're healthy and they don't have somebody in their house sick, we are doing more and more visits face to face. Next slide. This just talks about our percentages of referrals. So this is a voluntary program. We can't mandate that someone take this program. So we have to sell it. The nurses have to have a sales pitch when they call to talk about what the program might mean. We had just about 250 referrals in this 13-month time frame, and about 20% of them were admitted. Sometimes we'll get one referral, we'll get multiple referrals on the same person. So we'll get somebody that came into WIC and the WIC nurse or the WIC staff suggested the program. We might also get a referral from the clinic. Our biggest referral source in Morrison County is the Family Medical Center. So they give us referrals on everybody that comes in pregnant, and we connect with them. Sometimes they decline while they're pregnant, but then when they get home with that baby and they're a little bit overwhelmed, we'll call them again and they'll say, hey, yeah, I really would like you to come out. The vast majority of our clients are admitted to the MESH 2-year program that's evidence-based. A few are just admitted to the traditional maternal child nursing because they aren't really interested in committing to the 2 years. The vast majority of those that don't commit to 2 years are people that have a baby that's underweight or was in NICU and they just want a couple visits for a nurse to weigh the baby and make sure baby's doing okay. So our sources of revenue, the Strong Foundations grant, which we combined a couple of other grants. I believe the Strong Foundation grant was actually about $81,000 for our county, but it was over $300,000 for the 3 county, and so we're all working within the budget on that grant. We also use some of the money. We obviously get some reimbursement from health plans and from DHS for doing some of the visits. A few here and there private insurance will pay, but our PMAP MA insurance does reimburse us for doing these visits. We got a good bump in our reimbursement by going to this MESH program. So we previously only got $63 for a visit. Now we're up to $153 or $142, depending on the health plan for doing the visits. So by going to the evidence-based program, we were able to increase our revenue because there's absolute proof that the programs work. And the way that they prove that is that we submit a great deal of data on our clients. It is voluntary and it's de-identified, but our clients sign when they're admitted, yes or no, I want my data submitted. The vast majority agree, especially when they realize that it's not attached to their name. But that data tells us what that child and family situation is like on admission and then at intervals throughout. And by the time they discharge at age 2, we can see some improvement. Some things that they track are, is this child ever involved in child protection? They track, is there anybody in the household that's incarcerated? They track, is this child on track with immunizations and development? All of those statistics are submitted. We're fortunate, our our PH doc system daily, takes that data. So every time a nurse completes a visit, there's certain data points in that visit. PH doc grabs that data daily and submits it to MDH for us. So that's pretty awesome. Next slide. We do a few additional billable services within the MCH programs. If we do a lactation consultation, a dental varnishing, a particular screening, and depression screenings on our moms, all of those can be added on, so we can get that $142 or whatever the health plan pays us, plus a $10, $20 additional for the service. So if we do a dental varnishing, I believe we get $12 additional dollars. Our accounting department's done an awesome job of helping us work within our software to build that out so that we're getting reimbursement for all the extra little things that we do. So I talked about the Strong Foundation grant, and we had combined that with our former NFP grant. And in summary, family home provision, visiting provides pretty significant amount of support to both pregnant and postpartum moms and their babies. And sometimes we're providing that to a foster mom. It might be a grandma who's parenting. It might be a dad who's parenting. So it doesn't have to be just the biological mom. We focus on education and positive parenting, as well as making sure we're doing developmental screenings. Those developmental screenings are key. When we start to see a child that's falling behind, then it's hooking them up to the additional services so that maybe they don't end up in children's mental health, or that maybe they do need children's mental health when they graduate from our program, and we get that service early. And of course, the Department of Health relies on us to gather data, submit it, and it's the driver. If we don't have that data going into the state, we can't prove that our programs are successful, and we're not going to be able to get grant dollars. So it's all very much intertwined. The work that we do gathers the data that drives the reimbursement that we get. Questions?
Anybody have any questions?
Mr. Chair,
Commissioner Jelinski.
if I may, Cindy, and if I missed it, it'll be a quick answer. What kind of numbers are we looking at yearly? And I'm not talking about mom and child or mom and children, but if we're talking from from birth to 2, I think, are we talking about, I shouldn't even say numbers, I should say cases. How many, in Morrison County, are we talking about?
Right now, our cases are just about 100. Each nurse is carrying around 20 to 25.
Oh, really?
Yep. And remember that some of them are seen more often than others. but
Absolutely,
yep.
absolutely.
So we're impacting a pretty significant number of people. And
Thank-
again, those are all voluntary.
Yep, thank you. That's exactly what I was looking for.
Commissioner Blaine.
So this, thank you, Mr. Chair, Brad, Cindy, this is the second year of this program of MESH?
Correct.
I
We
was
started in
trying to look
November of
back.
2020.
Yeah.
So considering we started in a pandemic, we did get a pretty good rollout.
Yeah, and, because this replaced the old NFP program.
Which we've been doing for quite some time.
Yeah, we had been doing for a while, but we moved to the MESH program because it was the evidence-based program.
They're both evidence-based. NFP and MESH are both evidence-based. What MESH allows us to do is work with the intake period is a lot broader than what NFP allowed for. Plus, we can work with a parent who's had more than one child. NFP was very restrictive about intake and when you could start, and only first-time parents.
NFP, we were not allowed to admit anybody once they delivered. And we can admit people that have had a baby here. So that makes a huge difference, because sometimes people don't think they need help, and then they get home with this helpless child and realize, boy, I could use some support.
Or even more likely, we didn't know about the birth until after they're home.
And so now, plus a year since we made this transition to MESH, no regrets in that
None.
decision, and happy that we're where we're at.
Yep, easier to train our nurses, less expensive. I feel like it's a better program because it's broader. The nurses say it's easy to use, it's clear, it's concise. We've tailored our documentation system in PHDoc to the documents and the programs. So, you know, they have a paper binder, but everything is in PHDoc that they need to document.
Very good. Thank you.
Anybody else have any other questions?
I'm going to move on. I see Cindy's always prepared for me to drop a bomb on her, but talk a little bit about COVID. We are planning to do a 5 to 11 clinic next Wednesday, and then 3 weeks beyond. And Commissioner Lemire asked a good question this morning. Are we doing Pfizer now? And no, we are not doing Pfizer, but this is a Pfizer clinic. That's the only vaccine that's eligible for kids at that age. But really, MDH decided to do a clinic in our county. They had partnered with the school, and the school asked if we could move it from the school grounds, and so we're going to have it here. We are doing logistics. MDH is basically bringing all the staff to do the shots, all the vaccine. So
Correct. We will, all the schools, and we're partnering with them on some of the advertising. We're pushing out the link so that people can sign up, that sort of thing. So yeah, we're providing the space basically and a little bit of support for setup and takedown.
And then she does have some numbers if you'd like to just hear a little bit about where we're at today for COVID.
Well, COVID's starting to simmer down just a little, and I say that very cautiously. We did not experience a huge bump after Thanksgiving, which I'm grateful for. We're down to 224 cases in the last 14 days. We were well over 300 cases in 14 days for some time. So our case rate per 10,000 people is down to 65. That was as high as 115 at the greatest part of this surge. Probably the most encouraging number is that we're down to 24 school-age kids in the last 14 days. Those are ages 5 to 18. Of greater concern is the specialized beds. I know that we have some people in our county that are in the hospital that could use a different level of care, for example, ICU needing dialysis. However, one of our physicians called 25 hospitals in 5 states over the weekend looking for an ICU bed that could dialyze a patient whose kidneys had failed as a result of COVID and COVID medications. And that person is still here because they can't find that bed. So those highly specialized beds are an issue. The state's opening those decompression sites. They are up to 4 sites now. And the term decompression is a little confusing, but what they're trying to do is once people are out of that really acute, very, very ill stage, but they're still extremely weak, ideally you want to move them on to a long-term care facility or a rehab type bed. But they are so short-staffed in those facilities that there's no place to put those rehab-type patients. So the state's opened up 4 facilities to try and help with that because they can't admit more people into the hospital for much of anything if they're backed up with those rehab-type patients. And we're seeing that that's taking a little heat off, but the ICU beds are still at a premium. And then those super high-level ICU beds with dialysis or ECMO are very concerning. We're at 98, 99% capacity statewide for ICU beds. So people are sicker and they're sicker longer.
Good. Does anybody have any other questions? If not, Cindy,
Thanks.
I want to thank you very much for your presentation and all that you guys do down there. I know a few years ago we talked about, are we ready when something happens? And something happened, and you showed that you were ready.
You got a pretty awesome team right now.
Yeah, you do. So thank you very much for
Thank you
everybody.
very much.
Let's do this one.
I have 2 other items, one under public health and one under public health social services, if I may, Mr. Chair.
Yes, you may.
So the first one under the public, or the one under the public health is to approve a new owner license for Perkins.
So moved.
Got a motion by Commissioner Jelinski, seconded by Commissioner Winchester. Is there any further questions? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Thank you. And then under public health social services is a request to place an office support staff who is retiring at the end of the year. And again, they are our front end folks, very important. We are seeing an increase in individuals coming into our office. Applications are continuing to increase. So we are still needing to have this position.
So move, Mr. Chair.
Got a motion by Commissioner Lemire, seconded by
Second.
Commissioner Jelinski. Is there any further questions? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
That's all I have. Thank you.
Thank you very
Thank you,
much.
Brad.
Are you guys okay? You need a break, or?
I.
Okay, we need a 5-minute break.
Crossing his leg for the last
Why
5
wouldn't we?
minutes.
Like Jeffrey always says, why wouldn't we?
That's right. Why did you wait so long?
Yes.
I could done this at 10.
Is this catching, Randy?
What's that?
Is this catching? How's it going, Mark?
Good. We couldn't Melanie though.
You couldn't hear me? Okay. Well, if that happens, just raise your hand back there or something and we'll. Okay, well, that's fine.
Sorry about that. I try to watch for that.
That's for Commissioner Winchell.
Just a reminder, don't touch the mics too much.
Yeah, okay. Okay, well, they probably do that.
They do.
Yeah.
So not only was I confused about them not doing it together, they were confused because they usually have a resolution from a public hearing. There was a lot of, and she kept saying she wanted it separated out, but it was part of the public hearing, and then next was the grant. Talking about the public hearing.
You want me to start screaming at you right now?
No,
I mean, we're
No, I
muted,
just-
so I can just start hollering.
no, I felt so bad.
We're good, we're okay.
But I wasn't the
Tabitha.
only one confused.
No, I created confusion, and
Well, no,
the
I
point
told
was
you to.
to make sure that we conducted a public hearing, and that we did what was required by statute.
But they're right, the motion was for, like, they were asking, what is this motion for? Because normally there is a resolution after the public
And
hearing.
it's just to continue the process.
And Greg had mentioned that we didn't need to vote on that.
Right, right.
Yeah.
We
That's
just
why everyone was
conducted a
confu-
public
yes.
hearing, there was nothing to
Yeah.
vote on.
Yeah,
Right.
yeah.
And I forgot to slap Mike's hand, he should have abstained on the source code grant. I was gonna kind of wave to you, because you have one more.
It don't matter.
So you say we're batting 1,000 right now, huh?
We normally.
Because all it's doing is presenting to them. I'm not doing that up there.
Yeah.
I don't get involved in that. Whatever, yeah.
Yes, whatever.
And I did forget to mention this mesh thing, but again, Sourcewell helped us prepare for mesh. They gave
Morning,
us that
Chelsea.
grant,
Hey,
if you
good
remember,
morning.
for Joel, for home visiting.
That's
No,
where you text
that's
me
why
and
I
then I
was-
tell How them. are you?
Fantastic, thank you.
Text me, that's what Deb used to do.
I don't think that, because I really didn't make a decision. Sourcewell still got to make that decision,
Yep.
so it's fine.
Here, I'm paid,
Oh, look at that. Thank you.
paid.
Welcome, Chelsea.
Good, how are you?
I'm not, no,
I like your tie, Randy.
The cow tie, thank you.
Yeah.
I got, this is probably, this is pretty old, I just happened to see it. Probably 10, 15 years old.
That's when cows were Guernseys, right?
Yep.
Holsteins.
Doesn't have, it's made in the USA, so it's old.
Old, yeah.
It's old.
That's good.
Yeah, well,
Thank you, Mr. Chair.
No problem.
everyone can
Mike,
see now.
Mike, I thought you just wanted to talk.
I mean, that's why he was fidgeting so much, it's like,
You gotta just get up and go.
Yeah, Randy's hollering at me. You weren't helping me out at all. Hey, Chelsea.
Hi.
We have to wait here for
There, I can start drinking coffee again.
Yeah, start refilling.
There's room now. Eh?
Yeah. Uh-oh.
She takes minutes, don't she?
Right, and that's kind of what
that's right, where is she?
She must have had to go.
So we do the.
Tonight, yeah. That should take about 3 hours, 6 to 10,
About
maybe
10
4
minutes.
hours.
Hopefully we're done by 10.
I'll never believe we'll be out by 10.
I would say 11 is usually,
She's taking her minutes?
that's gonna be a long one.
Is that
Tax complaints.
T-shirt meeting?
Oh, no, full 4-piece suit,
Is it?
plus a mask.
So I have a hockey match. It looks just like that, from that Halloween movie or whatever that one is.
Jason?
Yeah, Jason.
Okay, we're back in session. Auditors report.
Wait, just about, Mark's got it now.
Oh, I'm sorry.
He's gotta plug us in.
You let me know when you're ready, Mark. Oh, okay. Auditors report.
Good morning.
Chelsea.
Morning, Chelsea.
The first on the agenda is something that we touched base with at planning session. This is a request for the county board to ratify the professional service agreement between Tryman and Minnesota County's Computer Co-op for the maintenance and support of the IFS system for the years 2022 through 2024 to support the county's financial system.
So moved.
Got a motion by Commissioner Wincher, seconded by Commissioner Blaine. Is this a roll call or?
Contract,
Okay.
I don't think so.
All, any more discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries.
Next on the agenda is something we talked about a little bit at planning session. This is a request to approve the resolution attached to submit an application for funding from the Vega 3, which is the voting equipment grant account to purchase election equipment and/or technology approved by the Minnesota Secretary of State's office.
Got a motion by Commissioner Blaine, seconded by
Second.
Commissioner Jelinski. Is there any further discussion on this? Commissioner Wincher.
Thank you, Mr. Chair. Chelsea, what's the dollar amount in this one again for that voting equipment grant?
Sure. I can go through the resolution if you want, to show you. In the resolution, it states the amount of grant funds that are available. We will apply, based on how many precincts we have. We can receive up to $5,000 per precinct. We would be utilizing these funds to purchase assisted voting devices. And the cost is roughly about that $5,000. So if I could go through the resolution, if you
Go ahead.
wish.
Yep, go ahead.
So the resolution approving Minnesota 2021 voting equipment grant application, whereas Morrison County is responsible for administering elections, which includes the purchase and maintenance of supplies and election equipment, and whereas it's essential for the precincts to have functioning voting equipment so that voters can cast their ballot on equipment that is secure, accessible, accurate, and reliable. And whereas the Office of the Secretary of State is currently soliciting applications from jurisdictions for grants to purchase voting equipment. And whereas the Minnesota Secretary of State's office has grant funding in the amount of $1,935,058.86 in the voting equipment grant account to assist counties, cities, towns, and school districts with the purchase of voting equipment. Whereas this funding was appropriated to the voting equipment grant account, Vega, to offset the cost to purchase any combination of optical scan counters, assisted voting devices, or electronic rosters. And whereas Morrison County agrees to provide a local match, at least equal to the amount of the grant received that is utilized. And whereas to receive funding from the voting equipment grant account, counties must submit an application to the state before December 17th. Now therefore be resolved, the Morrison County approves its application for funding from the voting equipment grant account, Vega 3 grant. It further be resolved that the county certifies that any funds awarded from the voting equipment grant will be used to purchase election equipment or technology approved by the Minnesota Secretary of State.
Anybody?
Again, Mr. Chair, thank you. I don't quite understand, it says on, whereas Morrison County agrees to provide a local match at least equal to the amount. So if we get, how many precincts do we have roughly?
We'll be applying for 32, that is how
So
many,
About 150,000, my guess in my math, if you have that, correct?
the estimate for cost is 160,000, and we would be required to match if we're using any of these funds 50% for assisted voting devices. We do have 212,000 roughly in reserve for purchasing these pieces of equipment. However, this is an opportunity for us to utilize grant funds and retain a larger balance within our reserves.
So if we get X amount of dollars, that would go into your reserve, because we have 200,000 in there anyway, so that would be for next 4 years or whatever, right? Because we, obviously, if it's, rough, you said 5,000 per precinct, that's what they need. We don't need this 160,000, because we would actually have 200,000 in there, but we're taking this as a additional amount. If you follow me.
We would be, with this request, we would be requesting for funds, and the funds that we receive, we have to match 50%. So we would have to use the grant funds and then a local match out of our reserves that we have set for election equipment. I do know that there is an additional grant funding coming, a different grant application that may support half of the cost, so we wouldn't have to use reserves potentially. However, there is set reserves to match.
That was the question. We don't have to use the reserves if we don't need, if we get enough grants.
Possibly, yes.
But more than likely, we're probably gonna have to use a little bit of money that we have or not.
My intention, when submitting this voting equipment grant application, we're submitting along with other counties, schools. So depending on the breakout that the state has, I'm hoping to get enough to offset half the cost of these machines. You know, without looking at further grant applications that will be coming in the future, we have enough set reserves that are budgeted to match this 50% plus more.
Well, I thank you for being aware of the grants and applying for them. That will help us out.
Yes.
So we do have a motion and a second on the floor. All in favor signify by saying aye.
Aye.
Opposed, motion carries.
And last on the agenda, I have a request to approve the bills.
Can I get a motion to pay the bills?
So moved.
Got a motion by Commissioner Lemire.
Second.
Seconded by Commissioner Jelinski. Any further discussion? This is roll call. Commissioner Lemire.
Aye.
Commissioner Wincher.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Blaine. And aye. Motion carries.
Thank you, gentlemen.
Thanks, Chelsea.
Thank you, Chelsea.
I would have forgot that. Nope. Administrators report.
Good morning, Mr. Chair, gentlemen.
Morning.
Today I have two resolutions in your packet, and we may not get to the second one unless necessary. The resolution here is, we discussed during planning, in regard to a 3% COLA increase to the commissioner's salaries for 2022.
So moved.
Got a motion by Commissioner Jelinski. Is there a second?
I'll second.
Second by Commissioner Wincher. Any further discussion?
Just want to reiterate what I said in the planning session. I'll be voting no against this, Mr. Chair.
Okay,
And Mr. Chair, I will say that this is no more, no less than county staff has received. I don't believe that any commissioner sitting up here is doing any less. I would say that they're doing more. At least I know that I am. And one day, none of us are going to be here, and I would sure hope that whomever would be taking any of our places would understand that they're not doing it for free, and nor should anybody do this job for free.
okay, thank you. Anybody else have any questions? If not, I think this is a roll call vote. Commissioner Lemire,
No.
Commissioner Wincher,
Yes.
Commissioner Jelinski,
Yes.
Commissioner Blaine. No. Commissioner Wilson, yes. Motion carries.
Okay, thank you, Mr. Chair. Three other topics, if I may.
Yes, go ahead.
So just wanted to share with the board, this week was AMC conference, a wonderful event. Met a lot of my counterparts down there and shared some ideas and brought back some additional knowledge. One topic that I'll just lightly touch on is the opioid lawsuit that's happening across the country and the state. There is movement underway. AMC has asked us to consider what they have determined as an appropriate settlement. The initial date that they gave us was the 17th of December, but no later than the 2nd of January. I've talked to Brian, the county attorney, about it. He is contacting our legal team there by the end of this week, and we'll be back to you shortly on the matter. That is all.
Okay, we have to have that done by January 2nd, right, voted? So
Yes,
we'll be
Mr.
voting
Chair.
on that, next-
That's correct.
That's on the 28th or something, right? 20 what?
21st.
Okay. Just so we have time, because I know we have to have that in by
Yep,
then.
they were very specific on time.
Okay, do you have anything else?
No, Mr. Chair.
Okay. Committee reports and upcoming schedule. I'd just like to say too, I was at the convention, and it was probably the biggest convention they've had in a long time. And there was a lot of good information there, and I enjoyed visiting with people. So. Okay.
Dates.
December 12th through December 25th.
December 12th through the 25th. Who would like to go first? Anybody volunteering? Commissioner Wincher.
That'd be fine. I'll yield to Commissioner Blaine since he kind of said before me.
Okay, sounds good.
So on Tuesday, the 14th, we will have a planning session at 8:30 a.m. On Wednesday, the 15th, there's a department head meeting at 8:30 that morning. Our county holiday gathering is that also that day, 11:30 or 12:30. On the 21st, at 9 o'clock, we will have a county board meeting. Now I have to go back. I believe on the 16th of the Thursday, the 16th, should be Fair Board meeting. And I believe that will be here at the, in the county boardroom, Egg Society, excuse me.
Yep.
And I believe that should be it.
Okay, I'll go next. All I have to add to that is community development on the 21st. And that's all I really have to add.
Okay.
Commissioner Lemire?
13th, Yellow Ribbon Network. It's going to be held at 101 East Broadway at 5 o'clock.
Okay.
14th, or is there a Board of Adjustments on the 14th?
Yep.
Guys, yes.
6 o'clock. Appreciation Department Head. That's all I got. Thank you, Mr. Chair.
Commissioner Jelinski?
Thank you, Mr. Chair. On the 14th at 7:30 in the morning, I'll be assisting a group called the National Wild Turkey Federation, delivering turkeys to the local food shelf here in Little Falls prior to our planning meeting. At 2 o'clock that same afternoon, I will be involved in a 911 telecommunicators work group. On the 15th at 11 o'clock in the morning, I will be involved with the Central Minnesota Emergency Services Board Executive Committee meeting. At 1 o'clock, the full board, Central Minnesota Emergency Services Board, will be meeting. At 5 o'clock that same evening, I've got a Hands of Hope meeting.
Where is that?
That's virtual, I'm sorry. Thank you. And I'm sorry, Tabitha, I believe that the Central Minnesota Emergency Services Board Executive Committee and full board are also still virtual. Sorry about that.
Yep, that's okay.
On the 15th at 3 o'clock in the afternoon, I have no idea why, but I have an asterisk here that says 3 o'clock, meet with the county administrator and Gary Weirs. Is that kind of like not so?
Commissioner Jelinski, I believe that's just on my calendar to do a teleconference with Gary. I don't think.
Beautiful. Thank you. It's off mine. Thank you very kindly. On the 16th at 10 o'clock in the morning, I have a Central Minnesota Emergency Services Board Owners and Operators meeting. That's virtual. At 1 o'clock that afternoon, I'm going to be sitting down with the new county administrator. On the 17th, let's see. Excuse me for 1 second, please. On the 21st at 2 o'clock in the afternoon, virtually at 2 o'clock, I will be meeting with the 911 Telecommunicators Work Group again. And finally, on the 23rd at 12:30 in the afternoon, I will be chairing the State Emergency Communications Board meeting virtually. Mr. Chair, that's all I have.
Thank you. Tabitha, I just got an email, airport on the 16th.
Sure.
So, does anybody have anything else?
Sure, I'll
I
give
don't
you
know,
my
was wondering,
report.
yeah, is Commissioner Wincher gonna go?
I know, you know,
I
skipped
know you're,
over
I
you.
know you're covered on everything.
well, actually, I'm
No.
not.
Okay.
The TCC's canceled.
Okay,
Great River Regional Library's
Canceled.
canceled.
okay.
But I do have a soil and water on the 17th at 8 o'clock here at the boardroom.
Okay.
And otherwise, that covers me, Mr. Chair. Thank you.
And if you were wondering about Region 5, our Region 5 and Encita meeting is actually this afternoon, or not this afternoon, it's this evening, but I had already told them I can't be there because we have two taxations.
So not on the 23rd, you're not coming on?
They moved it up and they have their holiday meal and all of that.
Yep, we're good.
Thank you.
Okay, could I get a motion to adjourn? We got a motion by Commissioner Wincher, seconded by Commissioner Lemire. Any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, motion carries. Randy, I don't know how I could miss you. I just jumped over you, didn't I? That's why I always start with Mike, you just come right down the list.
Jeff, what